Hello friends, I am Dr. Nilesh Chinchkar, Director, Chinchkar Center at Nilesh Multi-Speciality Hospital, Panvel, District Raigad. Today I am going to talk upon one disease which prevalence is quite common in the public but very few people know about this. The disease is called sleep apnea. Apnea means stoppage of breathing and sleep apnea means stoppage of breathing during sleep. The symptoms of sleep apnea are excessive snoring, excessive daytime sleepiness, lack of concentration, easy fatigability, fragmented sleep, morning headache, and lack of memory, loss of memory. The pathophysiology of sleep apnea, how this sleep apnea develops. Basically, sleep apnea is more common in obese individual or those individuals who gain weight very rapidly. It is also commonly seen in patients with anatomical disfigurement of the facial structure because of trauma or because of anatomical disfigurement present since birth congenitally. During sleep, the tone of the muscle of the body decreases and muscle tend to fall. In obese individual or patients with anatomical disfigurement, there is crowding of the throat structures, and during sleep, because of low tone, these structures in the throat tend to fall on the airway, and because of this there is blockage of the airway completely. And if there is blockage of the air won't pass in the airways and lungs will not get any air. Because of this, there is lack of oxygen level in the body. This lack of oxygen level is sensed by the brain, and brain sends strong signal removal of this obstruction. After sending signals from the brain, these structures got removed from the airway and the passage of air clears and the air enters into the lungs and oxygenation is maintained. And these things during sleep happens many times. That means many times the patient's brain needs to do work during the sleep. Patient is unaware of this. He thinks that he has slept whole night, but actually his brain was working throughout the night, and this fatigued brain which needs rest during daytime causes symptom of excessive daytime sleepiness. The lack of sleep, the lack of physiological sleep causes loss of memory, lack of concentration. It gives you morning headache, and it may sometimes cause road traffic accident also, because patient may sleep while driving. It is extremely important to diagnose sleep apnea because it is linked to hypothyroidism, it is linked to diabetes. Diabetes chances are 3 times more as compared to the normal individual. There are high chances of development of stroke, there are high chances of development of myocardial infarction also. That is why it is important to detect sleep apnea. The tool to detect sleep apnea is a simple polysomnography test which is conducted during sleeping hours. Polysomnography is also called as sleep test. In polysomnography test, we attach electrodes to the patient's body. We attach electrodes to head, we attach electrodes near eyes, on chin, this thermistor, and then thoracic belt and abdominal belt, and the electrodes at lower limbs. Polysomnography test detects all stages of sleep cycle. It also detects limb movements, it also detects postures, it detects eye movement, it also detects EOG, that is electroocculogram, it detects EEG, that is electroencephalogram, it detects EMG, that is electromyogram. It gives us apnea score, it gives us apnea index, it gives us oxygen saturation level, it gives us snoring index. Based on apnea index, we detect and categorize sleep apnea in mild, moderate and severe categories. And based on this report, we basically detect sleep apnea. After the diagnosis of sleep apnea, we call the patient for similar test with CPAP titration on next night. CPAP is basically continuous positive airway pressure machine which provides positive airway pressure throughout the sleep. This positive airway pressure keeps the airway open, therefore air easily passes and there is no fall of throat structure on the airway. Therefore, there is no development of apnea and patient do not get symptoms. After doing CPAP titration on another night, if there is improvement in the apnea score, improvement in the oxygenation level, then we advise patient to use CPAP machine daily night. After using this machine for few weeks also, patients get rid of all those symptoms and his quality of life improves. Therefore, friends, it is absolutely essential to know the pathophysiology and to know the basics of the sleep apnea, because it is linked to many severe disease, and it is also important to treat it to improve the quality of life. Friends, I hope you have understood the topic of sleep apnea. Thank you very much.